In 1969, a small group of Southside residents started an agency called HOPE, Health Organization for Public Ethics. Its goal was to secure health resources and deliver first-class health services to the growing multicultural neighborhood. The Health Contact Center was set up in a building on the corner of 16th and Greenfield, above the ICDP Resident Council, before moving a few blocks away into a storefront location once owned by Jensen's Jewelry Store. Partnering with the Milwaukee Health Department, SDC, UWM, and Planned Parenthood, the center offered a well baby clinic, family planning, prenatal care, sex education, and nutrition classes. In 1971, the Health Contact Center had a budget of $80,000 and a staff of 5. It was renamed 16th Street Community Health Center, and with a pre-planning grant from the Wisconsin Regional Medical Program, laid the foundation for a comprehensive ambulatory health facility to improve delivery of health care on the south side of Milwaukee. From 1980 to 1984, the 16th Street Community Health Center doubled in size, hired our first full-time family practice physician, and completed our first building renovation after purchasing the storefront building. By 1988, we served 5,395 patients, with 23,318 medical visits, and supported 2,524 WIC clients. Services were available in English, Spanish, Hmong, and Laotian. 33% of our patients were children, 69% were female, 83.5% were under the age of 35, and 38% were uninsured. In order to serve more people, 16th Street took on a major expansion project from 1994 to 1995, adding more exam rooms and space for WIC and administrative offices. We began outreach and case management services for persons with HIV and launched our environmental health department focusing on lead poisoning prevention and immunization outreach. 38% of neighborhood children tested by the center were found to have high lead levels. 4,500 kids were immunized, and 73% of our patients lived at or below the federal poverty line. In 1997, we opened a state-of-the-art dental center and hired our first mental health provider. By 1998, we had 150 staff, an $8 million budget, and began sustainable development work in the Menominee River Valley with a grant from the US EPA. In 2001, our reputation as a community leader in primary health care, health education, and other support services spread even further as we hosted special visits from U.S. Health and Human Services Secretary Tommy Thompson and Carolyn Kennedy. Secretary Thompson described 16th Street Community Health Center as one of the best examples of community health in America. At this time, we served nearly 16,000 patients. From 2002 to 2004, we re-engineered our service delivery process to achieve greater efficiencies and cost savings. By changing appointment protocols and converting to electronic medical records, we shortened wait and overall appointment times. We launched a comprehensive chronic care management program, and our behavioral health department had grown to support over 2,000 patients. In 2006, we opened our Parkway Health Center as a second full-service medical site, providing us with the capacity to serve twice the number of patients. After successful revitalization efforts in the Menominee River Valley, we turned our outreach and advocacy efforts into rehabilitating the KK River and surrounding neighborhood. Our HIV services received national recognition with an Excellence in Quality Management Award by the National HIV Qual Project. By 2008, the addition of our second medical site had grown to serve over 22,000 patients annually. The majority of our patients, 61%, live below federal poverty level, and 33% were uninsured. We enrolled more low-income families in Badger Care Plus than any other health partner agency in the state during the initial registration period. Our HIV services earned additional recognition for outstanding achievement by the Wisconsin AIDS Fund, the AIDS Resource Center of Wisconsin, and the Milwaukee County Board of Supervisors. And 16th Street as a whole was also recognized for service excellence and diversity by Keep Greater Milwaukee Beautiful. We began our 40th year of service with many accomplishments, including our highest patient total of more than 27,000 individuals and 139,000 visits to the health center. With the economic downturn and more patients than ever before in need, we continue to focus on high-quality services, infrastructure, and increased capacity with strategic planning. We made improvements to our telecommunications and medical record systems and began renovating our historic streetfront location to add more exam rooms and additional providers. As we continue on our mission to provide the highest level of medical care to the neediest individuals in our community, we feel fortunate to celebrate our 40th anniversary. Our many partnerships, supporters, and dedicated professionals who have made our journey to helping and healing our community possible.